the 40-year-old males getting myocarditis after vaccination. Those are things we need to continue to study and to consider. To make a blanket statement that they're safe is not fair, safe as we may know it at a certain point, but we are seeing things, and we will be looking at, in this committee, we will be looking at our VAERS system, the reporting of adverse events from vaccines. It's important that we do that and make sure that it's working, and it's to be honest, and it's to be trusted. So what we have seen throughout the pandemic is the public health establishment disregarding natural immunity. I mean, that's been very clear. We've all lived through that. Let me go down the line, starting with Dr. Makary. Natural immunity to COVID-19, a real thing that should have been considered, recognized, and studied?
Absolutely. We lost 1 million people from the workforce, roughly, because natural immunity was ignored. 1 million people leaving the workforce is not good for public health.
Doctor?
Yes, I think when it came to mandates, we should have absolutely made exemptions for people with natural immunity to save the workforce and to save our precious vaccines for those that were truly vulnerable, which is what many other developed countries did.
Do you think mandates should have been implemented without a consultation with the physician?
I think that mandates, when there is a public health benefit, can be justified. So early on when the vaccines were rolled out, when they did seem to reduce spread, they were justified. But exemptions should have always existed for those with natural immunity.
Well, then to that point, I will tell you that during the Trump administration, I made the recommendation that America needs to be hearing from the doctors that are treating COVID patients, not politicians. And that would be much more greatly embraced by the American people. Dr. Tan?
Thank you. I agree that you get natural immunity after infection, and I think that's important, but I think early on we did not understand or have the data to really support that, natural immunity would be the only thing to rely on. And we knew that as individuals got COVID infection, they were at much higher risk for going on to developing complications, now known as long COVID and multi-system inflammatory syndrome, both in children and adults.
I think we all agree that early on, no one knew exactly what, so we were all clamoring for a vaccine, but at the same time, should have been looking at natural immunity as well and take it into consideration in the overall treatment of a patient, as I pointed out with my own numbers there. In the summer of 2021, the CDC removed all references to natural immunity. Dr. Makary, do you know why?
They never talked about it. They upheld something I call the Novak Djokovic doctrine. That is, no one who is unvaccinated, regardless of prior recovery from COVID, was allowed in the United States under the false pretense that vaccines prevent transmission, that natural immunity was not a real thing, and that there was no risk whatsoever to the vaccine. And just a quick note, I don't like the conversation framed around all or nothing, entirely relying on natural immunity. Doctors custom tailor treatments all the time. And you know what? If somebody had natural immunity early on, maybe we recommend 1 dose or space out the doses or hold off on the booster. But this all or nothing cult around vaccine ignores the Freeman study that found that 1 in 662 doses results in a severe adverse event. Do doctors do an improper informed consent with that risk? In the early days of COVID, when we're losing 1,000 people, that risk is acceptable. Now, it's not acceptable. We can't have a 5-year-old girl get 77 mRNA doses in her average lifespan. That's what people are promoting without any data.
I had a situation where a gentleman called me about his son, and he said to go to school he has to get vaccinated. He's a perfectly healthy son, and I recommended 1 dose of the Pfizer. It will give him some immunity, and most of the myocarditis incidents were coming after the 2nd dose. So get 1 dose, get some immunity that way, which the majority of it comes from that 1st dose. Yet he was denied. He was denied accepting that. I said, get a doctor's note. School board was deciding this, not the patient and the doctor. The CDC website at that time, Dr. McCary also said, get vaccinated regardless of whether you already had COVID-19. Studies have shown that vaccination provides a strong boost in protection in people who have recovered from COVID-19. Any thoughts on that?
Well, the CDC's own data showed that if you were vaccinated and had prior immunity, that is the so-called hybrid immunity, or you just had natural immunity, you hit the same ceiling of hospitalization rates during the Omicron wave. So one dose may be reasonable, but we fired 81,000 soldiers just in one swath for not having both doses. That is arrogance, paternalism, and medical elitism. That is not the humility the American public expects. That's why child vaccination rates are down, unfortunately.
Any other care to comment on that?
Well, I mean, we know that vaccine hesitancy has existed as long as vaccines have existed. You know, with Edward Jenner and the smallpox vaccine, there was vaccine hesitancy then. I think with the COVID-19 vaccines, I think there was a misunderstanding in the general public about the role that they would play, at least, you know, in preventing the serious disease and infections and hospitalizations and death that may occur in individuals. And I think that's why it's so important to really protect those individuals, especially those individuals that have immunocompromised conditions. And children do serve as a vector of transmission to those individuals in the household.
If I could, before I turn over to ranking member for questions, you know, I have recommended any chance I get to say this vaccine is different from the other vaccines. And really, this mRNA vaccine has been more of a therapeutic than the other vaccines have proven to be as far as prevention. And I think that people need to know that. And our public health system today should be shouting that from the top of their lungs to parents of young children to make sure they get those other vaccines. But when they say you must get this one as well, I think that's an injustice, and that's harming our system if that's what they're advocating. I yield to the ranking member for his questions.
Thank you. I'm going to put my doctor hat right now. Natural infection creates an immune response in immunocompetent people. We've known that. We've known that for a very long time. Nobody ever denied that. Nobody ever said that getting an infection doesn't create an immune response, okay? The immune response and protection depends on several factors, and varies based on viral load, age, and immunocompetency. So it's not an easy standard response that everybody is going to have. However, natural infection with this virus causes severe illness, hospitalization. With this virus, not the chickenpox, can send you to the ICU. With this virus, natural infection can cause deaths. 3,000 per day, in fact. You know, this virus that mutates and that has an immune response that wanes leads to the need of reboosting your immunity. The goal is to boost your immunity to mount a rapid and strong immune response so that you don't get symptoms, miss work, or transmit it to a high-risk loved ones, or go to the ICU, or, God forbid, die. That's the goal here, people. Let's take a step back. Who wants to get sick and miss work? Who wants to transmit this to your little one or your elderly, grandparent, even if you've been vaccinated? So the best way to avoid symptoms from a natural infection or the risk of long COVID or hospitalizations or death is by boosting your immune response passively with a vaccine. Okay? Now, sounds like the narrative being pushed is to get infected with COVID-19. And if you get infected, then you don't need a vaccine, or prefer to get a natural infection over a vaccine for a deadly virus. Or that if you get infected, then disregard the vaccine or the booster. That seems to be the narrative here. That's just wrong, guys. It's just wrong, contrary to medical and public health practice. And it violates the oath of doing no harm. Look, let me clarify some things. Vaccines don't cause long COVID. Vaccines do not cause long COVID. Natural infection causes long COVID. Okay? Active infection, even in mild infections causes long COVID. Let me clear up another misinformation already stated. Yes, vaccines help reduce transmission. They help reduce transmission. It's not 100% you get a vaccine, you're not going to get infected. It's not 100% you get a vaccine, you're not going to spread it somewhere. Again, the immune response boosted by a vaccine hopefully is strong enough, rapid enough to defeat the viral load and how fast it replicates in order to prevent it from reaching a level to where you're symptomatic and you're transmitting it to other people. So with people who have that fast, strong immune response boosted by a vaccine, you're going to be able to prevent getting infected, and you're going to be able to prevent transmitting it to other people. Definitely hospitalizations and definitely death. But some people who are vaccinated may have received a larger viral load, a mutated virus, and their immune system may not have responded fast enough, and they still may get infected. They still may transmit it, and they may still be hospitalization. And yes, some may still even die. So it's not a simple black or white, 100% or not. It's understanding physiology and the mechanism of the immune response. So when President Biden took office, he hit the ground running to expand access to life-saving COVID-19 vaccines. On his first full day in office, President Biden issued the National Strategy for the COVID-19 Response and Pandemic Preparedness. The Biden administration's national strategy leveraged the Defense Production Act to rapidly increase our supply of vaccines, stand up vaccination centers in communities across the country, and mobilize a public health workforce to support a comprehensive COVID-19 response. So thanks to President Biden's leadership and investments from Democrats' American Rescue Plan, which every House Republican opposed, we were able to get more than 600 million shots in arms, laying the groundwork to safely reopen 99% of schools, reignite our economy, and resume everyday life. Dr. Tan, as a fellow physician, I deeply admire your commitment to protecting your patients, our nation's kids, from the constantly evolving threat of infectious diseases like COVID-19. How do vaccines work to protect patients and forge stronger immunity, even among those who have already experienced infection?
So, as you mentioned, vaccines work by boosting the immunity. And we do know that hybrid immunity actually is one of the strongest immunities in preventing hospitalization, severe COVID disease, and death. It also has been shown that it prevents the development of multisystem inflammatory syndrome, both in children and in adults. And one thing about MIS-C in children is that many of the children who develop this are unvaccinated, and when they do develop it, many of them either have mild or very little in the way of symptoms, so you cannot predict who's going to go on to develop MIS-C.
Thank you. Thank you. The Biden administration pursued a multi-pronged approach to encourage uptake of the COVID-19 vaccine and save lives. Alongside decisive action to increase supply and accessibility, the Biden administration instituted common sense requirements for healthcare workers and federal workers to get vaccinated. And as the novel coronavirus evolved, the federal government moved decisively to roll out safe and effective boosters to better protect the American public from new variants. Let me be clear, these actions saved lives. According to a Commonwealth Fund study published in December 2022, the Biden administration's COVID-19 vaccination strategy prevented 3.2 million deaths and 18.5 million hospitalizations. And without COVID-19 vaccines, the United States would have experienced 4.1 times more deaths and 3.8 times more hospitalizations. Dr. Tan, how have vaccines helped us to reduce the ongoing threat posed by COVID-19, particularly in communities that were hardest hit by the pandemic?
So the vaccine also helps to prevent transmission of the disease to other individuals so that, we know that the more the virus is allowed to circulate in the community, the more it's going to mutate and the more that individuals are going to become infected.
Thank you. So this is my last question. So, as we look to prevent and prepare for future pandemics, a crucial component of our work must be investing in the infrastructure to rapidly develop and deploy safe and effective vaccines. Look, the decision to concomitantly invest in producing the vaccine while we were in the R&D phase helped us rapidly deploy this. So there are lessons learned that we should incorporate in the next response. And in your written testimony, Dr. Tan, you mentioned the need for investments in vaccine infrastructure, infectious disease physician recruitment, research to better understand and combat vaccine misinformation and disinformation, and increased coverage for vaccines. Dr. Tan, why are these measures so important for our future public health preparedness?
This is incredibly important because these measures will allow us to protect the largest number of individuals so that we don't have another devastating pandemic where you're going to have lives lost when they could have been saved with the use of an effective vaccine. And, by building infrastructure for vaccines in both the adult and the pediatric populations, you're going to be able to save more lives all across the age span.
Thank you. I yield back.
Thank you. I now recognize the chairman of the full committee, Mr. Comer, for 5 minutes of questions.
Thank you, Mr. Chairman. I want to thank our witnesses for being here. The pandemic has definitely undermined trust in public health. We've heard time and time again those in positions of public trust in the Biden administration making misleading or false statements regarding COVID-19. Now, I want to run through some of these statements and ask each of our witnesses if at the time those statements were made, if science and data supported these statements. On June 22nd, 2021, Dr. Fauci said, and I quote, "It's as simple as black and white. You're vaccinated, you're safe. You're unvaccinated, you're at risk. Simple as that," unquote. Yes or no, Dr. McCary, did science and data support that statement?
Not anymore.
Dr. Smelkinson?
It did appear like that, but that, in the summer of 2021, it did seem like the vaccines were doing pretty well at suppressing infection and spreading it. But shortly thereafter, It was not. And they didn't look at that in the trials either.
I think at the time, based upon the science that was available, the statement was appropriate. But I think now, since, the pandemic is evolving,
Right.
so that we have to be agile enough to really go along with that.
Right. On May 16th, 2021, Dr. Fauci said the vaccinated became, quote, a dead end for the virus, unquote. Dr. McCary, did science and data support that statement?
In April of 2021, we knew vaccines did not stop transmission.
Dr. Tan?
It stopped transmission in some individuals, but not 100% stopping.
Dr. Smelkinson?
I agree with what they both said. It didn't.
On May
100%.
19th, 2021, CDC Director Walensky said, and I quote, "Even if you were to get infected during post-vaccination, that you can't give it to anyone else," end quote. Dr. McCary, did science and data support that statement?
No.
Dr. Smelkinson?
No.
Dr. Tan?
You were less likely, but it's not 100%.
On March 29th, 2021, CDC Director Walensky said, quote, "Vaccinated people do not carry the virus. Don't get sick," unquote. Dr. McCary, did science and data support that statement?
It did not.
Dr. Smelkinson?
Again, it may have appeared that way for a while, but the trials did not look at that.
Dr. Tan?
Yes, the trials didn't look at that, so the appearance was yes.
Finally, on June 21st, 2021, President Biden said, and I quote, "If you're vaccinated, you're not going to be hospitalized, you're not going to be in the IC unit, and you're not going to die," end quote. Yes or no, Dr. McCary, did science and data support the president's statement?
We thought that early on, but they denied the overwhelming data that was not true and made that statement after that data were clear.
Dr. Smelkinson?
That was around the time where breakthroughs were happening more rapidly. So I think that we could have seen that was going to devolve into more reinfections.
Dr. Tan.
I think there was some support for that, but, nothing is 100%. So I think science and data at that time was evolving.
Dr. McCary, by July 21st, 2021, were there vaccinated Americans that had caught COVID-19?
Absolutely.
Were there vaccinated Americans in the hospital for COVID-19?
Absolutely.
Were there vaccinated Americans that had died from COVID-19?
Absolutely.
Dr. McCary, was the president lying?
There was a lot of misinformation spread by public health officials that we had to close schools, that vaccinated immunity was much stronger than natural immunity, that the ideal dosing interval was 3 or 4 weeks, that we had to boost young people with no evidence to support it on long COVID, on ignoring natural immunity. There was a lot of misinformation spread during the pandemic, a lot spread by the CDC.
And I think this is why there's a lack of trust in American public health. Our leaders were unwilling to speak the truth and unwilling to follow the facts. And that's a big deal. Mr. Chairman, I appreciate the topic of this hearing. This is a very important hearing. We've got a lot of work to do in America to regain the trust of the American people in public health. With that, I yield back.